Mr. Imtiaz, a 30-year-old male from Karachi, works as a driver. He is married with 5 children and presented to the internal medicine OPD on September 11, 24 with complaints of loose stools persisting for the past 3 months. Mr. Imtiaz has no known comorbidities and is both normotensive and normoglycemic. He reported an insidious onset of progressively worsening loose stools 3 months ago. The stools are episodic, watery, brown, large in volume, non-foul-smelling and non-sticky. Initially, he experienced 3 to 4 episodes per day, which has since increased to about 6 episodes daily. There is no specific dietary trigger, as symptoms are not influenced by milk or wheat products and do not improve with fasting or avoiding certain foods. The stools are occasionally accompanied by mild, diffuse abdominal pain rated 4 of 10 in intensity, with no radiation but not associated with any nausea and vomiting. He also noted a small amount, less than half a teaspoon, of fresh blood mixed with the stool on some occasion and a sensation of incomplete evacuation after each episode. Additionally, he reports a weight loss of approximately 10 kilograms over 3 months, as evidenced by his clothes feeling looser. He has no family history of celiac disease, any history of itchy rash on the body or any improvement of symptoms on restriction of gluten-free diet. He denied any growth retardation history, joint pains with loss of memory, any history of TB or TB contact, low-grade fever with night sweats and any abdominal mass. He has no history of episodic flushing of face, whistling noise with breathing, any chronic epigastric pain that does not relieve with any stomach medications, any history of uncontrolled blood pressures, racing of the heart or sweating. He denied any history of diabetes, increased thirst and urination, increased appetite, any darkness of the complexion, dizziness on standing, any heat of cold intolerance, tremors or bulging of eyes. Patient also denied any history of passing large greasy stool, any history of tightening of the mouth, difficulty opening mouth, any oral ulcers, excessive hair fall and history of facial rash on exposure to sunlight, any history of decreased appetite, lumps and bumps, development of any history or known malignant disorder. Patient denied any prior history of inflammatory bowel disease, oral ulceration, anal fissures, any history of intravenous drug abuse, unscreened blood transfusions, high-risk sexual behavior, any history of laxative abuse, chronic chemo or radiotherapy and any history of colonic carcinoma. He has no history of diabetes and hypertension as mentioned earlier and has also denied any irregular heart rate. He has not mentioned any use of prolonged antibiotics, antidepressants, heartburn medications, laxatives and any immunosuppressive medications. He denied any night blindness, any oral or perioral lesions, hair thinning or hair loss, redness of the tongue, gum swelling, any skin bruises, bone pain and any difficulty in rising from sitting position. He also denied any history of abdominal distension, periorbital edema or generalized body swelling. He has no history of any yellowish discoloration of the skin with itching, redness of eyes, neck swelling, any history of fecal discharge from new body orifice, any skin nodules and joint pains. Furthermore, he denied any chronic low back pain with restricted mobility, any history of silvery scale skin rash and joint swellings with nail changes. Thank you for listening. Rest of the history pattern is same. Just remember our famous mnemonic and don't forget to subscribe our channel to support our work.